Good afternoon, everybody. Today's Friday, October 1st, 2021. My name's Scott McGann with the Falmouth Health Department doing Falmouth's weekly COVID-19 update. The phone number for Falmouth is for the Health Department is 508-495-7485. Our email is health@falmouthma.gov, and our website is falmouthma.gov. So I put this presentation up on there as well. So if you miss it, you could YouTube it. If you can't catch it all, you can also get it on our website. And FCTV obviously runs it as well. So we had a good week. So we're at 1,937 cases. There have been 23 cases during the week with 4 probable cases, which is the rapid test. These are not school-based test and stay. These are, somebody might go to Convenient MD or to the fairgrounds or to wherever. About 97% of the cases are out of isolation. The positivity data that we have for the week, percent positivity in our incidence rate is from the state. It's based on 9/12 to 9/25. We went down from 26.3 incidence rate. And what that means is our daily number of cases if Falmouth had a population of 100,000. And so 26.3 divided by, we're about a third of 100,000 would be about 8. So roughly, around 8 cases, and now we're at our positivity for this time frame is down to 18.3. So we've dropped from 26.3 to 18.3. And that's reflective of having a lower case count last week and a lower case count this week. It captured most of last week. It still captured a little bit of the week before. Our percent positivity dropped from 4.57 to 3.21, and that's just the number of tests that we give out and the percentage of those that are positive. And those are the ones that we use as kind of our metrics to see how we're doing case-wise, COVID-wise. If you look at our chart, number of cases, you can see that the far right is the last 2 weeks. So we're at like 32, I think, last week, 23 this week, which is definitely down from the 3 weeks that we had over 50, up to 70. Between 50 and 70 we had for 3 straight weeks. We've been able to get that back down to more where we were later in August, mid-August into early September. So, it's a good sign. It shows that we've made some progress at keeping it down, and so hopefully that continues. This chart here, the best way to look at this is the closer those little blue circles are flat, horizontal, and clumped together, the better we're doing case-wise. The more that they go vertical and spread apart are weeks that we're not doing as well. As you can see, when January was our worst, that sort of late December to into January. Then we had another one in the spring, and we had a couple of bad weeks over this past month, and so that's where you see those sort of peaks, just shown in a different graph. In terms of the counties, sort of similar. The counties had relatively better couple of weeks than they had over earlier on, let's say late August into early September. Hospitalizations have been fairly stable. So the one at the bottom shows August 31st of 3. Then we went to 5, 6, 7, 6. And this is just the total number of people in the hospital. So somebody may, from the 31st, still be in the hospital. There's a chance of that. So sometimes you're still counting the same people. These aren't new hospitalizations. This is just the number of patients at a particular snapshot in time, and I get this from the county on a weekly basis. So the last one I got was on the 24th, and that's where we are with that. So we're not seeing a spike in hospitalizations. We're highly vaccinated as a town, as an area, as a region, so that helps us with hospitalizations, no doubt. Statewide, been pretty flat. The positivity's been staying 2-ish or lower, which is great. We're back at 100,000 tests per day, so it's a high testing rate. We were close around 2,000 cases, I think, last week. We're at around 1,500. So the state's showing that, the state is showing sort of similar to Falmouth, sort of a leveling off. Again, highly vaccinated does help. Metrics seem all pretty good. You can see that in green is the testing, shows that it's been staying, peaked a little over 2, but it's been staying low. Again, vaccinations, cases are showing lower. The 7-day hospitalizations sort of leveled out. Deaths are sort of leveled out. And hopefully the trends get better, but at least they're not on the increasing side of everything. So good. This is the incidence rates among our peers. The reason why they use that 100,000 as a population is you wouldn't be able to compare, let's say, Eastham and Falmouth because we have more people, or Falmouth and Barnstable, or Falmouth and Worcester. it puts everybody in a level playing field based on a 100,000 population. So for us, we were on the higher side of the county. We were the highest a couple weeks ago. Definitely on a downward trend, because as it captures weeks of 30 as opposed to weeks of 60, it's going to lower our incidence rates. A little bit delayed to that. So our incidence rate for this past week is actually lower than 18 for the past 7 days. So that's kind of where we are with our peers, on the higher side than we'd like. We're normally in the middle, and we're a little bit on the higher side. There is one other town higher than us. All of the state, we're lower than the state in total, with Yarmouth being the only town that's higher this week for incidence rate. Percent positivity, all of Massachusetts is around 2. We're still 3.21, so we're higher than the state on percent positivity, more in line with our peers. And again, that number's on its way down, at least for this past 2 weeks. We were on a downward trend for percent positivity. We do a fair amount of testing. I'd say we're about, right now, averaging about 1,400 PCR tests per week. It's been about our average the last few weeks. In terms of the vaccinations, been around 73% of all individuals in the county are fully vaccinated. You look at us, we're at 81% of all eligible residents. Down the lower, it says 81% of all eligible residents are fully vaccinated, and 89% of residents that are eligible have received at least 1 dose. You can see there, in terms of the entire population, because there's not everybody, those under 12 or not, there you see that we're 73% fully vaxxed. If you take the entire population, 80% 1 dose. So the difference between those two numbers are just, one takes the ones with the total, the larger font just indicates the entire population. Down on the bottom, I just calculated out using, just taking out those under the eligible age group. So, actually, I mean to add that number doesn't add up. That's last week for 161. Sorry about that. We're about 230 something doses administered. I didn't change that. So about 230 shots were given this particular week. COVID cases in fully vaccinated individuals to date of 925, 36,000 breakthrough, 723 breakthrough cases, 1,155 went to the hospital, which is 3.15% of all of those breakthrough cases, and deaths among are 254, which is under 1%. So that tells you the vaccine definitely works. There are going to be some individuals that are sick for other reasons or very elderly. Those are the ones that you generally see are going to be hospitalized. Those are the ones we obviously we needed to protect at the beginning. Without a vaccine, we still need to protect them now, even with. And so that's kind of comforting if you've been vaccinated to know that it's doing its job, because these numbers are definitely much lower than they would be with Delta and unvaccinated. Getting back into vaccine availability, VaxFinderMass.gov, pharmacies have appointments. They do ask you now about 3rd dose appointments, and we'll talk a little bit about that. You can do it at the Barnstable County Health Office. Community MD had some. Community Health Center. Homebound, you should call the health department if you have somebody who's homebound. We'll make arrangements for that. So in terms of vaccine, go on the VaxFinder. I happen to look every couple of days. I'll just look at the websites, and I'll see that CVS or Osco or one of the pharmacies will have appointments available. And so if you haven't been vaccinated, this would be a great time to do it, because I think as boosters become more prevalent, that just chips away at the availability. So I think this would be a great time to do it. And if you need a 3rd dose, we'll talk about that in a second. As far as testing, we have a school-based test and stay, and it was a difficult program early on. Falmouth was, when school started, having more cases than we would have liked, and the schools had to work it out. So right now, this test and stay is definitely working better. We do ask if you're positive from a Binax test and stay. It's a rapid test that you get confirmed with a PCR. Can also, obviously, the big testers have been Convenient MD, CVS, the hospital. Fairgrounds will do it for free on Sundays and Thursdays from 4 to 6 if that works out. And the Community Health Center is also another place for testing. In terms of 3rd doses, who's eligible? Individuals with immune compromise due to particular health conditions have been eligible for a boosted dose of Pfizer or Moderna since August 13th. The following individuals are now eligible for a booster of Pfizer, only Pfizer, 6 months after their 2nd shot. Okay, so if it's been 6 months, you're over 65, you can get a booster, only if you've had Pfizer at this point. I think we're going to get something quickly on Moderna, but J&J, I have nothing for Johnson & Johnson at this point in time. If you're a resident of long-term care, you're eligible. People aged 50 to 64 with underlying medical conditions, 18 to 49 with underlying medical conditions, and just check those on the website. This is right from, you just type in mass.gov vaccine availability or eligibility or third dose. It'll all get you to the site. And it's going to vary the medical conditions between the two age groups. And those that are 18 to 64 are at increased risk for COVID exposure and transmission because of their occupational or institutional setting, so different types of workforces, medical, that type of thing. Do I need the same brand of vaccine for my booster? The answer is yes. We want you to get the same one. So those that have had Pfizer and you're over 65 or make one of these categories, you can schedule yourself. There is a section in when you register yourself at the pharmacies to do it. At this point in time, since there's plenty of availability at the pharmacies, you're not going to see the county sort of running large drive-through clinics at this time, or haven't heard anything that the state would be doing anything in particular. As long as the availability can be handled by the pharmacies, then it doesn't make sense to, because then we won't get a lot of people wanting the drive-through. You have 15, 20 volunteers there, and 25 people come for the clinic. Doesn't make a lot of sense on our end to inherently run it. So we will, as we see demand. If demand goes up, then we can set things up. We can run clinics. The health department will be running a flu clinic in probably sometime late. We haven't finalized the date. Sometime in October. We could also do some COVID. We'll be doing stuff, but it won't be these larger ones because the demand is. First off, it's one dose, so it makes it half as hard. And secondly, that the pharmacies, if they can handle it, it's just as convenient. When I click on there, I could go down there in an hour and get an appointment, at least when I go through the system. So if you want to boost a shot and you fit that category, talk to your healthcare provider. Make sure it's a good idea. If you're having trouble with whether your underlying medical conditions meet that or not, if you want to get one, then go right ahead. Again, demand may go up later, but right now I'm not seeing it, at least when I'm checking for appointments. As far as J&J, I haven't heard anything at this time. They're still doing research on it, so I haven't had any guidance for those who have received a shot of J&J. I would think we'd get that relatively quickly. I hope. Face coverings, nothing's changed on this. Again, we still have a mask advisory. The state requires it on mass transportation. If they want you to wear it if you have a weakened immune system or if you're unvaccinated. CDC looks at, and I show you this on the next slide, your level of transmission rate before you need to necessarily think about mitigation, and I'll talk to you about that in a second. Schools do require this, are requiring masks right now. So these are the metrics. So the line in the sand is that orange, yellowy orange line I put in between moderate and substantial. We've been in the low to moderate risk category. Right now our incidence rate's dropping and our positivity is dropping. If it gets real close or it starts to cross that line, then we need to talk about having other things maybe such as a mask mandate. We're not at an infection rate at this point. I think most jurisdictions have not implemented. Some jurisdictions have implemented mask mandates. I do receive calls that were asking me for a mask mandate. I think, the absence of state guidance makes it tough on health departments and local boards of health. So what we've done is gone to the CDC's guidance, and the CDC has given us that, and that's what we've been using. The other thing to consider that they want you to consider, not just the rate at which you're getting cases, is also the hospitalizations, which we've been relatively flat on, with a gain of 1 or 2 here, but not at a point where the hospitals are at surge capacity or any of those things those terminologies we would have been using last year. And also to look at vaccinations, and again, we've really hit it out of the park early on with vaccinations. We've done well as a community with vaccinations as of the entire county. So those 3 things is what we look at. But we do monitor it and we do discuss it. And I could easily, if things look like they're going in the wrong direction for enough times, like if we had a couple more bad weeks, then we may have pushed over that. Then we would have to do something about it. So. As a recap, our case counts have decreased significantly over the last 2 weeks. We had a drop by half and dropped by another third this week. Eligibility is still at 12 and over. There is some talk about 5 to 12-year-olds with Pfizer maybe mid-fall. We'll run clinics at schools. And I'm sure the pediatricians' offices may have them as well. But the 5 to 12-year-olds, that guy, that is, I only hear what you hear in terms of the news. I've heard that maybe sometime mid-fall, maybe even the end of October. I'm not sure yet. Of course, we'll get the word out, and the schools are well aware. We, myself and my public health nurse Kathy, we have call every week with the school department and Dr. Parkinson, and we discuss it. And we have our eye on when that happens. And if we need to flip a switch and start doing clinics for that, we definitely could. Third dose booster information has been updated. So the information I gave you was, I think, from Monday. I think when I did my presentation, I got that information from the state like mid-afternoon last Friday when I had done this. So I didn't have the most recent information about Pfizer. But the third dose booster information does get updated, may change. So if you've had Moderna and J&J, just pay attention. When I know, I'll put it out there about directions on the third dose of the booster shots for that. So again, our vaccine rates are good. Third doses are recommended for the immune compromised, and again, Pfizer on the list I just previously gave you. And vaccine, again, a little bit about vaccine breakthrough. Again, it definitely lessens the severity of the disease. We can see it when we do contact tracing and where people end up and how sick they get. So you definitely want to do that. So that's my update for this week. And again, I plan on doing one again next Friday. And everybody take care. Thanks.